I'm Ed Highland, and this is ASH News TV.
And I'm Rachel Kopchak. This year, ASH held a joint scientific symposium with the European Hematology Association.
The topic, the pluripotent stem cell and whether or not it will ever be therapeutically viable. Since they are derived from the patient's own cells, they are genetically matched with the recipient. Yet the process of generating these cells carries the risk of introducing new mutations and causing cancer. Here are the perspectives from both North America and Europe.
I believe that in the blood system, it's likely they'll have clinical utility within the 2 to 5 year time frame. Now that'll be first in human clinical activity, and maybe the real treatments will emerge later. But I highlighted the importance of embryonic stem cell and induced pluripotent stem cell derived platelets, the ability to make engineered T cells off the shelf, and the long-term ambition to actually produce hematopoietic stem cells for transplantation.
There's interesting potential with respect to cell programming. Not only can we bring cells back from a more mature stage in a very immature pluripotent stem cell, but it is also possible to jump across lineages. For example, these days we can take a few milliliters of blood and coax these blood cells into a neural stem cell fate, make neurons from these cells and use them, for example, for disease modeling, drug discovery, but hopefully also soon for therapy.
As the world's largest professional society of hematologists, ASH provides many awards and programs to support hematologists in all stages of their careers. How hematologists treat patients is ever-changing, and this year we're taking a closer look at 3 particular drugs and how they impact how clinicians treat patients. A special education session looked at 3 newly approved therapies. The focus was on issues clinicians face in treating patients, including appropriate populations, dosing, side effects, and adverse events. Dr. Stephen Pipe says albumin fusion protein, a new recombinant factor IX as applied to hemophilia B, is already changing his patients' lives.
Because of the tremendously extended half-life of a product like this one, we now have the opportunity for not just a less burdensome infusion schedule. Now we're talking about a once-weekly infusion schedule, but we're achieving factor level troughs that really never drop below maybe the 15 to 20% range. And that compares to trough levels where we were accepting maybe in the 1 to 2% range previously.
This session explored recombination that leads to the development of immunoglobulin receptors, T-cell receptors, and how those processes are regulated in normal development, and how they can go wrong and lead to leukemia and lymphoma.
It has been long suspected that infection is the driver of childhood leukemia, and we found one mechanism that would explain it, based on AID and RAG expression.
Kite is committed to one of the most ambitious goals of the 21st century, and that's finding a cure for cancer. Our product portfolio is unique in the fact that it harnesses one's own immune system and targets and kills cancer cells, modifying them so they'll recognize the tumor and attack and kill it. We're truly at the crossroads to make a significant difference and breakthrough for patients. We want to be the manufacturer and the company of choice for those patients in need of this critical therapy.
Welcome back to ASH News TV. Acute myeloid leukemia is one of the hardest to treat blood cancers, but a master trial just getting underway is bringing new hope to patients as well as promise to investigators. The Beat AML Master Trial was detailed at this news event, which brings together collaborators from ASH and the Leukemia and Lymphoma Society. In the trial, a select group of older AML patients will undergo genomic testing to assign them to a new investigational strategy.
The trial is really precedent-setting in that newly diagnosed patients will rapidly be treated with therapy predicated upon the genomics of their own cancer. It will be very adaptable, so if certain arms work, they will be pushed forward. If not, they will be dropped and new drugs will be added. It really is a paradigm-changing therapy in AML, which will set an example for other hematologic malignancies as well.
The outcome of patients over the age of 60 with AML who get standard 7 and 3 chemotherapy, when you look at 10 years, only 2% of those patients are alive and free of their disease. So it starts with a group that's common, where they have a lot of the abnormalities where we have new targetable drugs.
We initially started with 5, we've chosen 6 more, and we intend to keep having those calls go out because we want people to join if they want to be part of it. The second is that the nature of LLS being the central sponsor allows you to bring the whole trial apparatus to a new site in one fell swoop. And we think that's going to allow us to be nimble and add more sites without it being incredibly complicated or slow.
The reason that we're here at ASH actually is to make certain that hematologists and oncologists understand the protocol very, very well. They understand what's unique about it, and they're in the best position to be able to inform their patients and have a discussion about whether the trial is right for them.
You can use social media to join the conversation here at ASH 2016, but it does pose some questions when it comes to posting items such as research data. In this digital age, social media is recognized as an important and valuable means of communicating advances in science and medicine. You can use Twitter as a way to communicate information to patients for clinical trial recruitment, but you have to be careful they don't provide their personal info. Understanding where to draw the line on social media and patient confidentiality is key.
There's no perfect answer to patient interaction on social media. You know, I think, as I say, there was a time when even an email we felt was totally inappropriate with the patient, but we've evolved, and we've evolved our guidelines to include them in an appropriate way. And I think if we use the general approach that patient's confidential health record has to be kept confidential, that if a patient does reach out to me via social media regarding a personal medical issue, I'll immediately take it offline.
I really liked some of the points that were made here because it fitted right into the thought process, and you don't want to oversell, you don't want to overcommit, but you really want to educate. Whether even in some cases, pharma educating patients or patients educating, actually they educate back the doctors as well, because there's some things like Joe mentioned, doctors know a lot, but there could be another perspective.
One thing I learned today is that there are actually some FDA guidances related to things that you can say about trials or results of trials that I didn't know before.
Another way to get involved at the annual meeting is by participating in the ASH scavenger hunt on social media. In each edition of ASH News Daily, a clue will be posted in Section A. Follow the clue, then post a photograph of your find to Twitter or Instagram with the hashtag AshHunt16 and ASH16. Your favorites will appear in the next day's edition along with a new clue. And here's a hint, ASH News TV may even be involved in the hunt. Calling all female hematologists, you have the opportunity to connect with other colleagues and form important career and personal bonds. During the ASH networking reception for female faculty, you can find mentors and meet others in the profession.
Perhaps one of the things that this networking reception can show is that you're not alone, that the concerns that you may think are really pertinent to you and you're struggling with are actually the concerns of a lot of people. And so I'm hopeful that people will come out of this maybe with inspiration if there's a lot of people there, knowing a lot of people have similar concerns, and also some practical advice, new friends that they can talk to, people they can bounce ideas off of.
The ASH networking reception for female faculty begins at 7:30 p.m. and wraps up at 9 at the Manchester Grand Hyatt San Diego in the Coronado Ballroom and Terrace.